Good morning, Dr. Pozzi. Today you spoke about clinical research in practice. What is the take-home message of your lecture?
Yeah, I'm happy to speak about the topic of the lecture. I feel that the first take-home message is that it's possible to do clinical research successfully in private practice. I also want to maybe give a few tips how to get around some common mistakes in clinical research. The very first one is to really be methodical. And a very simple way to be methodical and to be clear with your study design, your clinical questions, and your hypothesis is to write it down. So it's crucial for me that you really have to write down a short proposal, even just a simple one-page short proposal. I would also give another important suggestion, which is to look in your practice at the type of cases that you see commonly, because you want to have enough cases to do your research. So really look critically at the number of cases that you see, and then try to come up with an interesting, novel question that you can answer based on your cases. Once you are looking at the sample size, I will make another recommendation, which is to try to keep the variability of the cases low. Remember that the higher variability you have, the larger sample size you need to test the hypothesis. And a simple way to control your variability is with inclusion and exclusion criteria. If we take, for example, a craniocruciate ligament rupture, you have a lot of variability, but you may want to include only complete ruptures. You may want to include only young dogs, maybe dogs younger than 4 years of age, and you may want to include only large dogs. Lastly, this probably is one of the most important steps. Really go and see your statistician early on. So at the time of your study design, you should really meet with a statistician that will help you really designing the study. I will finish with the last but very, very important tip, which is probably more than a tip, and it's about the ethics, medical ethics of doing research with clinical patients. I would strongly advise to use resources offered, for example, from universities. It's very, very important to perform clinical research accordingly to regulations. And each nation, each state has very strict regulation. And in general, always consider that anything that stays within standard practice, so something that you would do normally in a clinical case, is not considered research. But anything outside that should really go through an official, formal, ethical review committee. With this, I wish you to have a very successful clinical research project. Thank you very much.
Thank you very much.